Welcome to FUHCast, with today a special edition about our conference on 20 and 21 October in Swiss Hotel Al Marouche, our first updates in emergency medicine and trauma. And today I have the honor to talk about the conference with our CNO, Mr. Fakih, Mohamed Fakih, and the head of the Nursing Education Department, Ms. Domna. Welcome both in our podcast today. I'm really excited that the nursing has a big part to play in the conference, and I would like to speak with you about that. Mr. Mohamed, why is it so important, if we talk about emergency care and we talk about trauma, that the nurses are involved in this conference?
First of all, thank you for hosting me in this podcast. And nurses play instrumental roles in emergency care and in trauma from end to end, from the start to the finish of any emergency scenario or an emergency situation. Starting from triage, nurses play a major role in triaging patients, which is a very critical step for patient classification. In FUH, we use the CTAS system, which is the Canadian triage, but nurses can use any other level of triage. And based on that level of triage, the patients are classified on their level of emergency. Nurses also play a major role in rapid response for patient critical situations. They are members in rapid response teams. They are also members in emergency codes like code blue or code green or whatever color the organization picks. They have a major role in assessment and making sure that the patient is monitored properly and monitoring of the patient. Then the stabilization of the situation of that patient. So with the team, with the doctors and the nurses, they play a major role in stabilizing the case. Last but not the least, which is also very important, and it's something that nurses do very well, which is an emotional support in such crisis for patients and their family, and the follow-up also of the care of that patient after the emergency.
Yeah, that's amazing that indeed the nurses are playing such a big role in all aspects of emergency care and trauma. And this is good that you're mentioning, and that as well that they are playing a role in the mental well-being of as well staff as patients. And on day 2 we will have as well a special tray about the mental health. Ms. Domna, I saw in the agenda as well that one of your nurses are going to speak about the importance of communication during a trauma. Can you give us a brief about what the nurses can take from this talk?
Hello, Marlies. Thank you for hosting us. Marlies, one of the major challenges in trauma care and in trauma cases in general, ensuring that the accurate information is there when the nurses are receiving patients from the field, from the ambulance, from the actual scene. So ensuring accurate data is very important for nurses. So by attending such sessions in these conferences, we are going to explore standardized communication tools, standardized communication ways where nurses can really actually not miss on major information, transfer them from different multidisciplinary teams, whether from the ambulance, from the field to the hospital, to transferring the patient to the unit or any other floor. So basically, handoff, SBAR is really, really important for those, for healthcare provider to follow, to ensure proper communication.
Thank you, everybody. We are looking forward to welcome you on 20 and 21 October on our conference on first updates in emergency medicine and trauma care. For everybody who is interested in this conference, please leave a comment and we will send you the registration link.